There you go. Thank you, Jessica, for being here today. As we've discussed last week, that I'm going to do the skill-based instruction, which is TAEDL301, provide skill work instruction, and this is task 9, as we've discussed last time. And in this session, I'm going to discuss about pressure injury risk assessment. Now, I know you've been nursing for quite a long time, and you've probably done this like in a regular basis. So what do you think pressure injury risk assessment is?
It's assessing person's skin, so skin's integrity. Of course, if it's older, you will assess that way. Because working in day surgery, I haven't assessed many, we haven't gone through many skin assessment. We just do like A to G assessment and all those.
Okay.
But when we do A to G assessment, you can like check the skin integrity. We ask them, do you have any pressure injury or do you have any wound that you need to take in consideration? Those sorts of assessment we do.
Yeah.
But not because I haven't worked in like elderly area patients with like elderly and all those area I haven't done where I have to do many skin assessment.
Yeah. Anyway, that's basically pressure. That's basically assessing the skin. So the place where I work is that you have to do skin assessment on every single patient, so from birth to adult, and skin assessment on within like 4 hours of admission, like 4 hours once they hit the door. I'm so sorry, I've got a bit of cough and a bit of
that's okay,
itchy throat at the moment.
That's okay.
So let's start with the PowerPoint. I'm just going to share the screen now. I've prepared a PowerPoint here. Can you see it, Jijisa?
Yes, coming now, yeah.
Yeah, that's good. So this is pressure injury risk assessment. Next slide. Okay, I'm going to have to click it here.
Yeah.
That's right. So as we've discussed that already, what pressure injury is, that's basically pressure injury is a localized damage to the skin or underlying soft tissues, usually over the bony prominences. And how the pressure injury occurs, that's from the pressure or pressure and shear. Pressure injury doesn't have to be open ulcer. It can be open or it can be intact, but still pressure injury can occur. And most of all, it can be very painful as well. So we talk about pressure injury all the time, and I just want to ask you again, like, why do we need to do the pressure injury risk assessment?
I think the reason we need to do, because sometimes not every patient can tell you that they have some kind of skin tear or anything, and if they have a prolonged stay in the hospital, it's going to get worse. So it's better if patient notifies us, or it's better to do the assessment, so to know if there are any existing patient skin condition, if patient has it, and then so we can make a plan for a treatment.
Yeah, that's exactly the right, because pressure injury these days, what they say is pressure injury is the key performance indicator for how the health facility is. If they are actually managing well, then it is completely preventable. And then, for example, if this person's got pressure injury, it's going to affect their quality of life. So and also the cost of the hospital is going to be a huge more. This is the Australian Wound Association, which I got the information from, and they've said that prevalences of pressure injury is about 25.5%, which is like a huge burden on the healthcare system. So it is preventable. The only thing is you actually need to assess to make sure the chances of developing pressure area is low. The earlier we introduce the tool, the better result for the patient. Excuse me. So what do you think the risk factors for the pressure injury?
The risk factors are if they're lying on the bed for quite a long time, Another risk is, it's depend age as well. Age is
Yeah.
the major contributors. Sometime, I guess, if they have a surgery on that area, and if they're lying on that side for certain hours or certain days, it can get worse.
Yeah, yeah, that's exactly right. There's, um, I've actually divided into intrinsic factor and extrinsic factor. Intrinsic factor, like they've got chronic illnesses like diabetes, where they have a bit of neuropathy. They don't actually feel the sensation. Advanced age, because the skin gets, proper, like paper thin, and risk of injury, and immobility and inactivity. So as you said, after surgery and stuff, they've been in bed for, prolonged period of time, which can cause pressure injury, malnutrition, because yes, your body is actually not having enough capacity to build up quickly, and skin temperature and pH. So that's another thing. If your skin is too hot for long period of time, and that can again cause breakdown. Extrinsic factor, which is like a pressure, shearing is like a gliding the skin within each other, frictions, similar, moisture. For example, the patient is incontinent with urine and things like that, that can actually cause a pressure injury. So not all of the things we can manage, but few things we can actually address to prevent from developing the pressure injury. So there's a risk assessment tool. I'm sure you probably use the same risk assessment tool in your hospital. Which tool do you use in your hospital?
Because nowadays everything is online.
Yeah.
So we have like when we do adult admission, uh, it will ask you the skin integrity. If they had a fall in past 6 months, and if you tick yes, then it will take you to another page, and it will ask you if is there any open wound care, if there is any pressure area that you have noticed, then that's where we record it. So that's how we do it.
So that's yeah, that's pretty. I guess that's pretty easy. We've got
Yeah.
we've got like a documentation here that we do, and we use the tool called Braden Score. Braden Score.
Oh yes, yeah, we have that, but we don't we don't use it. I heard this. Yes, yeah.
You don't use this tool.
No, but because I think working in day surgery, we have mainly pre-op patients, and post-op we discharge them on the same day. So that's why we don't come across. But I did hear this word like a bread and score.
Yeah, yeah. So in today's session, I'm gonna go a bit more about Braden
Yeah.
Score, um, because I used to work in South Australia in Royal Adelaide Hospital. They use the same thing here, the same Braden Score as well, and we use the same. So I'm not sure. I think it is like widely,
I think yeah, it's Australia wide. I think.
Australia wide. Yeah, yeah.
Yeah.
So developed by Barbara Braden and Nancy Burstone in 1987, and it's quite like used around the world. So in Braden Score, there's 6 main topic that the Braden scale has explained. Like, for example, I've actually got the copy here as well. So it talks about sensory perception. So sensory perception is basically ability to respond with the pressure related discomfort. Like for example, patient is lying there for like 2 hours and like saying, oh, my back's getting sore because I've been lying there for too long. And depending on the score, it's we've got like a one, score 1, 2, 3, and 4. 4 basically means that patient can respond very well, and 1 is completely limited. And this can come with some some paralysis patient where they've got no sensory ability to move themselves. Another one comes as a moisture, which is the degree of moisture that our skin is under. So for example, they are incontinent, or they are, they can go to the toilet, but you don't need to change the linen. So again, this is 1 is constantly moist, 2 is very moist, 3 occasionally moist, and 4 rarely moist. Another one is activity. It's a bed fast or chair fast or walks occasionally or walks frequently. So this is the degree of physical activity. Another one is mobility, which is whether they're completely immobile or very limited or slightly limited or no limitation at all. So that's a degree of physical activity. This is degree of like how the patient can change the position and the control their body position. Nutrition, so this is the usual food intake pattern, whether they like don't eat at all, they eat half of the meal or quarter of the meal, or they like have a good appetite. So that's how we assess the patient. And another last one is a friction or shear. So so depending on how the person lift their body themselves up to the body, or somebody has to slide them across, or if is there any problem with that. So that's like a problem, potential problem, or no apparent problem. So this is just a Braden score, and I've given you a bit of in a box that very high risk is less than 9, high risk is 10 to 12, mild to moderate risk is 13 to 18, and no risk will be less than 18. So depending on what category they fall into, we will have to manage differently, and we probably need to do different strategies to manage to prevent the risk of developing pressure injuries. After this, I'm actually going to go through the paperwork that we do. So what I'm going to do is I'm going to stop share, and I'm going to do another screen share of the document, which is can't find it. Where is pressure injury? This one. So can you see this, Jujitsu?
Yeah, I have seen that. I have done this before.
Oh, okay. Oh, that's good. That's good. So as soon as the patient walks to the door, as I said, within the 4 hours of admission, we fill this paperwork. So I just want to go through the steps of assessing, the pressure injury. What do you think the first step would be?
While doing admission?
No, while we do assessing the skin.
The first, I guess you ask the patient first.
That's right. Yeah, you always explain and ask consent whether they're happy with the procedure, what we're doing, and making sure making sure you're safe to do the procedure. For example, if the patient is like aggressive or very agitated at that time, it's probably not the best time to do it. Come back next time when the patient's quite settled. So you always assess the environment to make sure you actually are safe for the patient and for yourself as well. Because this is a skin assessment, it's quite sensitive matter. So you always maintain the dignity of the patient. Making sure the curtains closed. So privacy. Making sure the privacy is very, very important. Yeah. So as it's clearly in the paper, you go from the head to toe assessment, checking if there's got any pressure injury, as you've already said, and check if there's skin tears or any medical device, which I've just written it here, like IVC, like IV cannula or portacare, scars or anything like that, or if they've got any excoriation, or if there's a suture line or anything that's relevant. And you document it here, you sign and date, and then time and everything. And the last button here is called like a patient refused skin inspection, which is another important button because not everybody will agree to it.
Yeah.
Some people like completely flatly refuse, and this is the if they don't want us to check the skin, and you explain, but they still don't want, then you tick the button saying that patient refused. Because I think one episode what happened here was they completely refused to do the skin assessment. After a couple of I think few weeks gone by, this patient like very aggressive, not wanting to do anything, and he developed the pressure injury, and it was asking, I'm gonna actually sue this hospital now because you guys didn't take care of my skin, and now I've got pressure injury, I'm stuck. So you know, you're looking back like, okay, we've documented that you haven't allowed us, you know, given consent to do the skin assessment. So something to back up our nursing degree, I guess. So once, the main important thing when we do skin to head to toe assessment is checking any bony prominences like hips, heels, you know, the bony prominences. That's are the more potential to get the skin injury, and also the scalp, and also the sole of the feet. Excuse me. So those areas are very, very important. Next step, I'm going to go to, again, the Braden scale. So this one I've actually done as mine because I'm walking around. I'm actually don't have any chronic health condition and things like that. So what I've done for myself with this Braden scale is sensory perception. I've got no impairment, so I can respond to my pressure-related injury. Like I'm sitting down on the chair, I can stand up if I'm feeling uncomfortable. So that's why I've given score 4. Same with the moisture, I'm fine. So my skin's usually dry, and that's why I've given number 4. Activity-wise, I'm giving myself 4 because I walk frequently. And mobility-wise, I've got no limitation. I can move my body if I feel discomfort without any assistance, which is number 4. Nutrition, I eat most of the meals. Nutrition-wise, I've got excellent score, so I've given myself 4. And shear and friction, I've got no apparent problem. I can move in my bed, in my chair, and I've got sufficient, you know, strength to lift my body up. So I've given 3. So calculating all these numbers, I've given myself 23, which is no risk. So in this assessment, we are only going to talk about, this session, we're only going to talk about pressure injury risk assessment tool. We're not going to talk about any strategies or anything like that, which is going to be a big session on itself. Another thing that after this I want to talk about is give patient the documentation of self-education, you know, the education prevention information sheet. Can you see it? Okay, let me just close this. Oops, what happened here? How do I close this now? Oh, stop sharing. How about now? Can you see it now? In a bigger picture? Yeah. So in this one, it says how to stop pressure injuries. So keep moving. Basically, it talks about keep moving, stop sitting in the same position for too long, eat good food because your body needs a good balance of nutrition. So your skin has got good elasticity, so it can carry the oxygen that, you know, the skin needs to be healthy. And also take care of your skin, like moisturizing. They said moisturizing twice a day it improves the prevents the pressure injury by 50%. So those information is in every bedside. And after all of these things, we do the documentation. Obviously, in the pressure injury risk assessment tool which I showed before, and also in the progress notes, saying that if there's anything, you just document, like, you know, this patient's got pressure injury or some scars, or no, this patient's skin is intact, the risk is low. So we can follow back if we need to. There you go. So this is how you do the risk assessment, the skin assessment, and Braden pressure injury risk. Now, next step, I want to go through with you again, like how we managed to do it. If possible, Gigi sir, can you please again go through with me? How would you do the skin assessment? And I'm probably doing the I'll probably do the observation checklist at this point.
Yeah, that's fine. So if I have a patient, of course, I'll, as you know how it says, there's an image there. So if any of the body part of the patient, if they have a, like, on right leg, right hand, you can circle it here.
Yeah.
Um,
Just before you do that, what is the first step that you will do before
oh
you
yeah,
do
so
this?
if I have a patient, of course, I'll ask them the permission,
Yeah,
ask their like a verbal consent to
that's
like
right.
what we're going through. So you explain the procedure,
Yeah,
and you explain why you're doing it and what it like helps nursing staff and doctors to to provide the treatment.
yeah,
And then I will assess the skin. So how it says, if there is a wound present, then I will document. If there is any skin tear, if it says yes or no yes, then you mark the site where they have it. Medical device institute, so if they have any like cannula, so because, or um, any other dressing where you need to, I think, document it, because it might turn into pressure area as well.
that's right.
Any rash present, so which again you will assess their, if they have any like pressure area, and if there any rash present, then you will document it.
Yeah,
Excoriation, you will look out for that as well, if there is any,
yeah,
or any scarring or any previous surgery they have, or if there any an open wound, or if there is any infected wound, it's there, we need to document it. And if there is any suture line,
yeah.
of course you will look at it, like if it's been healed, and or do you need to do any further treatment for it.
That's exactly right. Yeah. Uh, During the admission, we also do the weight, patient's weight,
Yes, yeah.
to check further down to see how the patient's doing with the weight, because the weight is another important thing to look at. Next step is just to do the Braden scale. Braden scale. So we'll do the 6 factors there, and then we'll just go through like how do you score the patient. So I'm just going to give you the simple like for
Explanation.
example, you just take yourself, like
Yeah, yeah.
how would you score the Braden score?
So
So for
I'll,
sensory perception,
yeah. So if there is, I guess if it's pretty healthy, there is nothing, then you can, no impairment, then you can give 4.
yeah,
If there is slightly, if you notice anything, in like, if suppose if you touch their hand and squeeze it, if they can't feel it, if a minimal sense, like they sense it, then you can give 3.
yeah,
Same moisture, so if like a healthy person like us probably will have 4.
yeah,
And another one is activity, so it's depend some, if it's elderly patient, or if they are chair bound or bed bound, then you'll score them according to their situation.
yeah,
Mobility, you will assess the mobility, if they, how mobile they are. If there's no limitation, then 4 again.
yeah,
Nutrition, so nutrition you can probably by weight you can tell as well sometime, or when you assess the person you can tell, you can ask them as well, like how's your eating habits, have you lost any weight in last few months recently, without trying. And if they says yes, then probably there might be some changes, like 2 or 3. Friction or share, again, if there is no apparent problem or no potential, then you will give 3. Yeah.
yeah, exactly. So will you give some kind of information to the patient as well to look after their skin?
Yeah, I will. So of course, being a health professional, we have to tell them like, look at, how to look after your skin. So moisturize all the time and keep it clean. So hygienic wise, they have to maintain their hygiene
Yeah,
and moisture. And if they see any wound or anything, they should go to GP and get it assessed and
yeah,
treated.
that's right. Yeah, eat healthy and keep moving.
Yeah,
Those sort of things. Yeah,
yeah.
exactly. That's very good. And finally, what would you do? Finally, you've done everything, and wait, would you do any recording or anything like that?
Yeah, so whatever I notice, I will document it. And if there is any, like, if you are concerned about something, then of course you will pass that message to treating medical doctors, or you know there should be a wound specialist or anyone that we will recommend and we will document in the EMR.
That's amazing. Everything's spot on. Very good.
Thank you.
I've just got to quickly ask you one more question before we stop it. I've just got the assessment questions here.
Yeah.
So can you see it?
Yeah.
It's a little bit.
All the factors that reduce itch.
I'm just going to make it a little bit bigger. So identify all factors that reduce tissue tolerance to pressure.
I guess all of the above.
That's right. And identify which patient should have a pressure injury assessment on admission.
I think every person on admission from birth to adult.
Exactly right. That's it. I've got another few questions. You've said that already before, but the factors, the predisposing factors of pressure injury.
So age?
Yeah. Just mention 3 will be fine.
Previous surgery?
Yeah.
And if they are like a bed bound or chair bound for longer period.
Yeah, that's right. And what do you think, why do you need to try to prevent the pressure injury?
For person's well-being.
Yeah.
And I guess to keep them,
quality of life. Yeah.
Yeah. To promote quality of life or enhance.
Exactly. Great. So when you assess from head to toe, what are the main, like what are the main things that you shouldn't miss? Which part?
I guess buttocks, which you need to check. Back.
Yeah.
Probably legs as well.
Yeah. So all the bony prominences.
Yeah.
So there's a risk. Yeah. This is the 6 factors that we've just discussed in Braden 2. Do you remember?
Is that the one sensitive and all those?
Yeah.
Sensory
perception.
Sensory perception, and I don't know if there was visual.
The Braden score one, the 6 of them, those ones.
Oh yeah, moisture activity.
Yeah.
Moisture activity, mobility. And I can't read another one.
Moisture.
Nutrition.
Yeah, that's right.
Malnutrition, probably.
You said one more thing: sensory perception, moisture activity, nutrition. You said mobility as well.
Yeah.
Yeah. And the last one will be friction.
Yeah.
Yeah, friction and shear. Yeah. Yeah, that's great.
Thank you. That was a very nice presentation. You covered all. Lucky you, I got more knowledge about, because before I didn't know this much. Thank you. It was very nice.
Oh, thank you. And you did really well as well. You were like quite, interactive, very interested, and I really enjoyed doing this presentation with you.
Thank you. I enjoyed as well.
So I will send you the feedback form in your email.
Yeah.
And just return it back to me.
Okay, I will.
All right. Thank you, Gigi-sa. I'm just going to stop sharing. So I'm just going to do stop recording now for now. All right. Thank you.
Thank you. Now